All right, let's look at vitamin D. I want to show you guys this case study of a client of mine who went to her doctor in February, had her vitamin D level drawn, and it was extremely low. So she started working with me, and the very first thing I had her do was get some micronutrient testing. Now, in her micronutrient testing with the red, yellow, and green down there, you can see that her vitamin D level was green. It was sufficient. So I want to talk about why, because this is what she asked me, why the vitamin D levels are so different between the two tests. What does it mean? What's going on? So let's break that down here, okay? So with the vitamin D in your bloodstream, which is the vitamin D level that was measured in her doctor's office, which is those top lab work that you can see there. That is vitamin D that's in your bloodstream in an inactive form, and it needs to be converted into its active form inside of your body. Now, some people have issues with this conversion process, which can cause lower levels of the active form to be in the cells, even though the circulating level might appear sufficient. So in her case, even though her circulating vitamin D is low, that number that we see there, her body may still be able to use what's available in the cells, just not efficiently, okay? Now let's talk about storage versus active use. So vitamin D is a fat-soluble vitamin, and the body stores it in its fat cells. Now, some people have enough vitamin D stored, but it's not getting released and utilized into the bloodstream at the necessary levels. So the cellular nutrition test, the one on the bottom there, might be detecting sufficient stored vitamin D inside the cells, but the blood test, the one on the top, might be reflecting a lower active level, okay? Test sensitivity and differences in measurement. So these two tests measure different things. The blood test at the top is more commonly used for clinical assessment, and that reflects how much vitamin D is circulating in your body, which can be influenced by your diet, supplementation, sun exposure. And then the cellular nutrition assay, the one on the bottom, focuses on how well vitamin D is being absorbed and used at the cellular level, which can sometimes reflect more efficient use even if your overall levels are low. Okay. Now let's talk about vitamin D binding proteins. So vitamin D is carried in your bloodstream by binding proteins. And so if there's an issue with the amount or function of these proteins, which can be affected by a lot of things like inflammation, liver function, or some other health conditions, it could result in low circulating vitamin D levels, even though your body's cells may still be utilizing it efficiently. And then lastly, let's talk about chronic conditions and gut health, because conditions like poor gut health, digestive issues, chronic inflammations, you could be using a GLP-1, you could have had gastric bypass, you could have had some kind of stomach, intestinal, GI surgery, chronic inflammation. That's all going to affect the absorption of vitamin D in your digestive tract, which can lead to low circulating levels despite adequate amounts showing up in your cells. So if you've got any gut-related issues, that could be a huge contributing factor to low vitamin D or variations in your vitamin D results from your blood work. So in summary, to kind of cover everything that we talked about here, the discrepancy that you're seeing here could be a combination of factors that influence how vitamin D is transported, stores, activated, utilized in your body. So that's why having a multifaceted approach like vitamin D injections, like oral supplementation, like food is needed to quickly correct the deficiency and ensure proper levels for long-term overall health and well-being. And one other thing to consider also is considering how low her last vitamin D level was in her blood work. I don't know if maybe there was a problem with the blood sample and maybe all of her lab work was off. So that's why, because that happens. And so that's why it's really important to look at things in context as a whole story without just looking at pieces and parts, which is often, so often, what people come to me doing is just picking apart their lab work when your blood tells a story. We have to look at it as a whole. So it could be that, in fact, this blood sample was tainted or was just not a good sample in some way, shape, or form. Maybe something happened with the lab, maybe something happened with transport. Like, I've sent so many things to lab and it comes back and they tell me that there's a problem with the sample. So it could be a lot of things. So that's why it's really great to look at things in context, as part of a story, as part of a whole, and then how it relates to you. So I hope you found this video about vitamin D and lab work helpful. If you have, give it a share with a friend. And this is exactly the type of detailed, nuanced work that I do with my private clients. So if you'd like to learn more about working one-on-one or in one of my group programs, be sure to send